Hello, I'm Dr. Dana Day, Clinical Doctorate of Audiology and founder of Arizona Balance and Hearing Aids. Today I'd like to spend a few minutes and talk to you about benign paroxysmal positional vertigo. You may have heard it as BPV, BPPV, and even some of you may have heard it as ear rocks or crystals that have come loose in your ears. So let's start with looking at the anatomy of the ear. This is the outer ear here. This is the ear canal. This area here is considered the middle ear. It consists of the eardrum or the tympanic membrane and those three bones that we learned when we were in school. Then finally we get to what's called the inner ear. And the inner ear is comprised of the cochlea. That's this snail-shaped structure right there. And that is responsible for how we hear, or it helps us in how we hear. And then this area here is the balance mechanism, or the inner ear that helps us with our balance. And I'd like you to think about this as your gyroscope. It tells you where you are in time and space. So if we take that and we move it over here, you would see that in the inner ear, there are three canals. Those three canals are responsible for three different movements. One, shaking your head yes, one, no, and acceleration, deacceleration, moving forward, moving backwards. And then located in this area right here is the macule of the utricle. And if you take that and blow that up, this is what it looks like here. So as you can see, these areas here are what we call the otoconia, or the calcium carbonate crystals. That's where we get the word crystals from. And in looking at this, they do kind of look like rocks. And this is located, again, in that balance mechanism there. It is located in a gelatinous substance so that it can rock, or the crystals can move back and forth. And the reason for that is if it allows us to move off of our center of gravity, such as bending forward and not fall forward. So they have to be able to move a little bit. Now through aging, trauma, extended illnesses, and blows to the head, these crystals, or the otoconia, can become loose. And then simple gravity will throw them into one of these canals when you move positions. So for example, from getting into bed. So if you sat down on the bed, your canals would be like this. When you go to lay down, they tilt up, and these just drop in 93% of the time into this canal here. This is this posterior canal, but it can also drop into the horizontal and anterior canal here as well. How do we know where they are? Well, we know that through looking at the eye movement. So if we take just a moment, this is an example of someone who has posterior canal benign positional vertigo. You can see that there's some rapid eye movement that lasts for less than 1 minute. In fact, this one I think lasts for less than 30 seconds. But during this time, the symptom that's going to happen is a severe vertigo, like you're being pulled down or that the room has flipped on you. And it can be very violent and it can be very scary. Now, watching the eyes tells us which canal we need to treat. And once we know which canal we need to treat, it will also tell us what treatment to use. Because, as I said, there are three canals. Movement of the eyes is distinct for each of those canals, and the treatment for those canals is also very specific. I hope you found this information educational. If you have any other questions or you think you have benign positional vertigo, please give our office a call at area code 602-265-9000. We'd be happy to set up an appointment with either our audiologist or our therapist. We're here for you.